Knocks on door. Hi, my name is Morgan today. I will be your nurse. I'm going to be taking your vital signs. What is your name? Okay, great. And your date of birth? Do you have any allergies? No, and you're not experiencing any pain? Okay, great. First, I'm going to start with a two-step blood pressure. And I'm going to, well, I guess I'm going to start with this two-step blood pressure.
During the two-step blood pressure, Morgan is going to place the blood pressure cuff on the patient's arm. Once she gets that into position, she will check a radial pulse as she is pumping up the blood pressure cuff. Once she loses the patient's radial pulse, she will deflate the cuff and she will know where she needs to pump it up to get the patient's blood pressure.
It stopped at 120. So when I pump it up again, I'll pump it up to 140 or 160. Okay. Get that off here.
She needs to wait 2 minutes before rechecking the blood pressure. So during that 2-minute wait, she will check the apical pulse, which can be found at the left fifth intercostal space in the midclavicular line. She will count this pulse for 1 full minute. When she has completed this pulse check, she will then check the patient's respiratory rate, leaving the stethoscope on the patient's chest so that the patient does not know that she is counting her respirations. Since 2 minutes have passed since she checked the initial blood pressure, she can replace the blood pressure cuff and finish checking the patient's blood pressure. When assessing the blood pressure, she will put the stethoscope on the brachial artery. She will then inflate the cuff to her predetermined number based on when she lost the pulse. She will then slowly let the air out of the blood pressure cuff while watching the needle on the dowel come down. And this will give us an accurate blood pressure on the patient.
I got 120 over 80.
After the blood pressure and vital signs have been recorded, she will assess the patient again, and she will make sure that the patient is safe and comfortable and has all personal belongings within reach.
How are you feeling? Are you experiencing any pain? No? Was that a comfortable treatment for you? You feeling awesome? Okay, I'm going to lower your bed rails. I'm going to lower the bed all the way to the floor. I'm going to make sure that all of the wheels are locked. And I'm going to give you your call bell. And you would press this if you need me, and I'll be in, okay? I'll be back to check on you in an hour.